to see you all. This is January 19th. We did one day early schedule change due to inauguration tomorrow. And I don't know if you can watch it. I'm sure it will be on the television. So let's go to the slide number 1, which is the same old slide that we want to keep COVID-free Cambria and viral illness that spreads from person to person, and each one of us take responsibility. It is a public health issue, and we take preventive measures. And if you're sick, don't go out in public, and wear a mask if have symptoms, and wash hands frequently. And symptoms you're watching for, if you have any of those, like dry cough, fever, weakness, fatigue, and headache, could be just one of that list. Nausea, vomiting, diarrhea, congestion, rash, or loss of taste or smell. And so this is worldwide cases increase from the last week. January 13th, 92 million, and we have over 96 million now. So in a week, there is 4 million new cases, and deaths are about 100,000. So that's a tremendous number, still not well controlled. This is United States. We have seen steady increase in the last 6 days. We have almost under 1 million more cases, and this is about 18,000 deaths in 1 week. So I think in one day, yesterday or day before, it surpassed 4,000 number, 4,000 deaths in a day. So that is alarming and doesn't look like it's going down yet. So be cautious and take all the precautions. And in Columbia County, there's a steady increase, 300-400 more cases. And remember, 39 deaths last week, and 6 days there are 5 more. And when we started this program 13 weeks ago, there was 4 deaths. So definitely it's on the rise. And this is new reported deaths per day. If you go on the graph from October and look at December and January, we had a little dip there. That was, little improvement. All the preventive measures were taken. Then they relaxed them, and then it went up surging. It's a plateau. It looks like it's going to come down now. And so a lot of people being vaccinated, and I'll go into those numbers, and you will have an idea what's happening. CDC recommendation for prevention, they ask to wear mask over nose and mouth, and it just not prevents infection in the other people, but it also helps you not to inhale their germs or viruses, which are in the air after, if they're close by and they're talking loudly or singing or shouting. You keep your distance 6 feet away from the others, 2 arm lengths, so that's a rough guess. And avoid going into crowds. And especially in the poor ventilated spaces indoors, where there is like a bars and worship places. If there's not good ventilation, I think you're taking a risk. If anyone who is 3 days in the infection doesn't have symptoms or is symptomatic is there, is going to make other people ill. And the recommendations continue that you get the flu vaccine. Flu will be there this year again, and influenza A and B. There are certain number of hospital admissions and deaths related with influenza. So don't let it build up two viruses together. So it will still give you some um, prevention measure if you get a flu shot. And cover your cough and sneezes, and dispose of those napkins and tissues and in a dustbin rather than throwing anywhere lying around on the carpet or a table or chairs or anything like that. Clean and disinfect as a routine your those places which are commonly touched many times a day, doorknobs, toilet seats, and those flushing buttons or levers. Monitor your health daily. You have, if there is a slightest inclination that you're going to be not feeling well, check the temperature. Make sure it's normal. And this is after COVID-19 infection. They have done a study now, 6 months after symptoms onset. And this was done in Wuhan, China. And there was people who did complain of fatigue or muscle weakness, and sleep difficulties were the main symptoms of patients who had recovered from the infection. And the other group was anxiety and depression. Those were the psychological implication of infection. And to elaborate a little bit more details, fatigue and muscle weakness was the highest number, 63% of patients 6 months after the infection, and 26% sleep difficulties and hair loss, smell disorder, palpitation, joint pains, and decreased appetite, about 8 to 9%. And taste disorder, dizziness, diarrhea, vomiting, and chest pain between 5 to 7%. So you can see that some people don't completely recover for a long time. So take notice of that, you know. This is, people talk about herd immunity. Herd immunity is that when you expose the population to an infection, they develop antibodies, and those antibodies protect them from, and the people who didn't have infection protect them from getting the infection. So this graph shows the gray area here is where there's a rise in the peak. And you can see that in about 9 months, this peak keeps going up where the red dots are, and those red dots are antibodies. So there were very few antibodies to begin with on the left side of the graph. When the gray area, the infection came, and it was about 1 or 2.5 months, it peaked. This is from Brazil. And so they peaked and they start making antibodies. So those, then the infection decreased to nothing almost. And when they checked their uh, blood for the antibodies, these little red dots showed that they have the antibodies. So it did prevent them from getting infected. So that's a good thing. And we don't know how this will affect us, but definitely after infection, a certain group of population will develop antibodies. And this we talked about last week. There was like 11 cases, and now there are 122. It's spreading. It's not the election, red and blue, but it's a light blue and blue. I think it's the virus. It's spreading. It's a variant of the virus. And initially we had B117, which started from United Kingdom. They had 7 or 9 cases. All of a sudden, within a few weeks, cases reached to about 1,000. And so then it starts spreading from the West to the Europe and Middle East and Far East. So they spread it the other way. And now we have, it's quite serious. And we don't know if the vaccine will work against this variant. Um, they haven't done any trials on the variant because they change. And I'll show you how they keep changing. And so it's difficult to create a vaccine for that. This is adding to the tragedy here. And B117 is 0.5% of all infections. And so the other infection are 452R, which is a variant they just found yesterday in Ohio, 501R in South Africa, and the same strain is in Japan, and L452R in the United States, and 501Y in the states in California. And so very dangerous time coming. So we have to make sure we do take the preventive measures. Let's see the next one, the vaccines, Moderna and Pfizer. They are RNA based. And AstraZeneca, which is viral based. They are available. AstraZeneca just being released. Pfizer has been main supplier. Moderna is doing well behind Pfizer, but they have some side effects, and there was one batch in California which turned out to be problematic, but I'll show you that. Let me see if I can go back here. Okay. Let's talk about carrots and sticks to get frontline healthcare workers vaccinated, because everyone is not sold on that. They're hesitant, healthcare workers, to accept vaccine because it's new. We don't know long-term effects, how it will affect the health, and especially pregnant women and those with allergies and have already had COVID-19. Mistrust of authorities, government, politicians, and employers. And two long-term care chains requiring workers to be vaccinated to keep their jobs. And Kentucky hospital workers who refuse the vaccine and then get COVID-19 will be denied paid medical leave. So they have to take their regular PTO, those work days. Georgia, long-term care chain offering gift card for a free breakfast at Waffle House. And Houston Methodist offering $500 bonus to the employees. In the Southeast, long-term care chain offering 4 days of extra PTO if they get vaccinated. So you can see that they are trying to sell the product, and definitely it has effectiveness in prevention, but it does have side effects, which are, let's see, um, I think maybe the next slide. And history of government mandating vaccines. As you remember, children attending public schools required to take vaccines, the normal polio and diphtheria and pertussis and all that, DPT and tetanus shots. 1905, Jacobson versus Massachusetts Supreme Court upheld rights of authorities to require smallpox vaccination. So if there are a lot of deaths, then I guess the legislative body will require that vaccination should be taken. Hospitals may require staff to take influenza and hepatitis B vaccine. As you know, that if you're working in a healthcare, you have to have that so that you don't infect other people or don't get infected yourself. EOC issued guidance that allows employers to require workers to get COVID-19 vaccine. So this is just the guidance from equal employer committees, And Moderna, that's the slide I was looking at, had allergic reaction, and California Department of Public Health paused administration of batch of Moderna vaccine, just particular batch. After 6 cases, anaphylaxis at Petco Stadium Superstation drive-through site in San Diego. So people were coming and getting the shot and going away, and they noticed 6 cases of anaphylaxis. And all healthcare workers who had reactions within 15 minutes observation window. So the most of them within first 15 minutes will have it. 330,000 doses, 10% of all doses allocated to California. So it's a very small number, but it was associated with lot number 041L201A. So I don't know, other batches are infected or will cause reaction, we don't know. They're going through quality control, so they're aware of it. Bell's palsy after COVID-19 vaccine, the facial palsy on one side. Pfizer reported 4 cases of Bell palsy in phase 3, which was, checking out when they were testing it. Moderna reported 3 cases of Bell palsy in phase 3 as well. Israel has vaccinated 20% of its population as of January 16th with Pfizer vaccine, and there were 13 cases of Bell's palsy. If Bell's palsy occurs after first injection, second is given when the Bell's palsy has resolved. So it recovers, but it may take 6 weeks to 12 weeks. So you don't get the second shot till you're completely out of it, improved. And these are the doses distributed, 31 million. Remember a few weeks ago, I said there were 38 million required in group 1A, which is nursing homes and healthcare workers. They are not close by any standards. Doses administered is 12 million, and 1 dose recipients are 10.5 million. 2 dose recipients are 1.6 million. And as more and more states are getting the vaccine now, I think these numbers will increase. Uh, the people are trying to give 4,000 shots at one place of facility. So they're making arrangements to do mass injection. And this is in Dubai. Uh, Seems well on its way to widespread COVID-19 immunity. What you do there, you just call the number. They give you appointment right away. You go in and get the shot and get the second shot date, and you will go back and get that. So they are using China-made vaccine, and that's a different vaccine than RNA, but they do have Pfizer as well. My niece lives there, and she received her shots already today. And this is the virus, the new variant virus. It's a cell, and is coated with different circles of proteins. And these reds, spikes there, actually it is called spike in the protein. So the idea is to either RNA change the spiking protein, or you inject a virus, which is kill the virus, not active. It will attack the cell, and these spike proteins will be attacked, and they will be producing antibodies to kill the virus. So this is the mechanism. You go in there, and antibodies attack the virus, and you get a kill. So Sinopharm is the vaccine, and AstraZeneca are both viral vaccines. The other viral, the same mechanism was used and still used in polio vaccine, as well as in hepatitis A vaccine and rabies. So people have very little reaction to these vaccines in the past. So hopefully they will be okay, and they're in phase 3 most of the places, but since Dubai is, and China and Middle Eastern countries in India and Pakistan, they're going to be depending on Sinopharm about 80% of their supplies. And so let's see what happens in the next 6 to 12 weeks. We will know more, the immunity wise, because there is not enough data. But to move around, to go outside, you need to have either infection and antibodies in your blood, or have a vaccine and create antibodies so you are not vulnerable to the disease. So there are those two measures. And this is a system, I think I did mention briefly 2-3 weeks ago, notification, emergency notification system. It uses a Bluetooth to detect if two devices are near each other without revealing where the devices are. They will just beep signal, and generates a random ID for each cell phone, which changes every few minutes, so can't be used to identify a person, location. Phone periodically checks all the random IDs associated with positive COVID-19 cases against its own list. So they have all the data who has positive test, because it's already recorded. So their cell phone is triggered with that. And when you go with your device near that cell phone, it will beep. And so give you warning that someone nearby has COVID. So is there a match receive COVID-19 exposure notification with further instructions and all that? I I think people are leery about public health authority and the government taking a peeking on your data and where you are and what you're doing. I think there are a lot of problems, but uh, I'm not afraid. I have the device here on my phone, and actually, I don't go out, so I don't have any beeps. if you if I have to go out and say somewhere in the crowded place, I will be notified. So that's it. There's a little bit safety measure. And this is a review of available, soon to be available on vaccines. And if you, I'll share the slides with you, and you can, you know, log into that to find out where and what, and all the questions will be answered by that. So I think caught up this week. Um, and the same are test sites we have. And yeah, I'm caught up. So now we can answer questions, right? If there is any.
With the new variant, they're saying it's easier to catch it. So should we be wearing different masks, like N95s all the time instead of just the cloth ones?
No, N95 is mainly for healthcare workers, and it's a little bit finer filtration. As an ordinary surgical mask, a paper mask, which is available, or three-layered cloth mask uh, is better to wear as long as it's tight on the nose, bridge of the nose, and it's not short on the side of the mouth. And people have a tendency to pull it down. So keep it on, but you don't have to go to N95. The virus variant is the same size as the original virus. What it has done, it has just changed its characteristic, so it attacks a new cell, uh, looking like a new virus, but actually is just a variant of COVID-19 or COVID-2, and it was same as SARS a few years ago, which caused pneumonia and death. So you don't have to panic for the variant, but because we don't know if the vaccine is going to work against the variant, that's why we're concerned. Good question.
I downloaded the Wisconsin exposure notification, even though I don't really go anywhere either. But it is kind of neat because you can get on and everything is confidential.
Yes.
And you can get on and it says no recent exposures. So I don't know. I think because it's confidential, I'm not worried about it. You know what I'm saying?
Yeah.
Did I miss the meeting?
Much either.
Go ahead.
Can you hear me?
Yes, I can.
How are you, Doc Sam?
I'm good, Cody. How are you?
I'm just walking out of work.
Okay. Give me an update, Cody. What you've been getting the news on the COVID vaccine?
We've been doing good. COVID numbers, COVID vaccines are starting to trend upward. Hopefully this false information is going away. We will be starting to vaccinate this week in Columbia County firefighters and law enforcement. And then starting next week, we will be starting with the 65 and older crowd. So that's going very well. I'm actually due for my second dose tomorrow.
Yes,
So I'm very about
you
that.
had it one last week or 2 weeks ago. But tell me about what's the process for people to make the appointment and how they get in?
So that's for like law enforcement and firefighters right now. We are contacting them directly and having them send us information. And then later on this week, there'll be numbers coming out from the places that will be giving the vaccines for the older than 65 group. And what will happen is there'll be a number you call to schedule an appointment. So it'll be kind of a first come, first serve to start with, as long as you're over 65. So.
Okay, okay. And you know if it is Pfizer or is it Moderna?
I have not heard yet. It's depending on, we at Divine Savior so far have been doing.
Okay, okay. That's good.
Very rich in Columbus. And
yeah.
I haven't heard of the pharmacies, what they are giving yet either.
Yes, yeah. Okay, very good information, Cody. So appreciate it. Any other?
Lose ya?
Cody, you're out now. Can't hear you.
Yeah, I can.
Let me try it. Are you there?
Yes. I didn't hear what you said.
Ah, there we go. There we go.
2 seconds ago. What?
Oh, yeah, we have been giving the Moderna as far as I am aware of.
Okay.
I have not heard what the other facilities around us are giving.
Okay. Thank you for clearing that.
And then, yeah, and then we have been doing testing in Cambria. Last week, we only tested 60 people. The numbers continue to trend downward in testing, unfortunately, which is kind of giving some false hope. We don't know if the numbers are down because people are heeding the warnings to stay home, but the numbers are continuing to trend downward across the region as well. So,
yes, we will not know that why the number, you know, is. I mean, apparently it looks like it's a good sign, but on the other hand, there could be an explosion sign as well.
correct. The one thing I can say that's a good telltale sign is, knock on wood, it's been hospital admissions. I track hospital admissions more than I track the actual daily, the daily total number of cases, because that's the key sign to me is the hospital admission rate. Just because of where we were in November to where we are now, that's been more of a telltale sign to me.
True. And the other thing is that if you are traveling by air, they would require that you have a test which is showing negative, especially international flights. So more and more airlines would like that certificate. I think people should be aware of that so they can get their testing. Thank you. Okay. We will. Cody, thank you so much. Did I lose you or you're done?
No, I'm still here. I'm just listening. I literally just got in my car. It was a crazy day today.
Okay. All right. Okay. You've been busy. Yes. Okay. All right. Any other question before we wrap up tonight?
Dr. Sam, this is Dewey.
Yes, Dewey.
I just thought I'd mention I was a little late getting on with you. I had just been on the website. Since you left town in a hurry, my provider for healthcare now is UW Health, and they just announced this afternoon about a system and a website for the 65 and olders to start signing up. So I just thought I'd give it a whirl, and I've submitted my application already for getting in line or whatever they do. They work through your provider, whoever your doctor is, and then they get back to you and call you when it's available.
Yeah. If you registered, I heard within 48 hours. So you will hear from them. And it also depends on the supply of the vaccine, how much
Right.
they have. So, but definitely they'll be in touch with you.
Is there going to be some kind of concern as far as if they're doing these mass vaccinations at outlying areas versus physician's office, as far as reaction to if they, like you had given the example where a couple of them had anaphylaxis problems once they left the site? Is this going to be a concern or not really?
Off-site, they are prepared to take care of the anaphylaxis. But if it happens, they recommend that you wait, 15 or 30 minutes. And usually anaphylaxis doesn't happen after 30 minutes. There may be other reactions like a headache or rash or sweating. There'll be enough time for them to call 911 or get help. So there has not been any deaths related to vaccine.
Cody, did you, of course, you did all healthcare workers and they were in the clinic situation, but like with the firemen and police officers, are they going to be observing them at all following the vaccination or no?
Did we lose him?
Cody, are you there? No, he must be gone. Okay.
I think they will follow the instruction. I think they will take the shots. I mean, that's
I'm still here. What was your question, Joanne? I apologize.
I was just wondering if with the firemen and the police officers and et cetera, when you give their vaccination, are they going to be in a setting where they're going to be observed at all, or are they going to be given the injection and go on their merry way?
Nope, you have to wait 15 or 30 minutes, depending on, that is part of the questionnaire. So if you've had an allergic reaction in the past, you must wait 30 minutes. If you don't have a history of anaphylaxis or reaction, you wait 15 minutes. They also, at these vaccination places, have to have protocols in place, Epi, Benadryl, and stuff available to administer that right away if you were to have a reaction. So like our firemen and stuff, they are going to Columbus to get their shots. So they actually go physically to Columbus. When we start our shots in Portage at Aspirus tomorrow or Thursday, they will be coming to us and have to wait as well.
That's good to know. Thank you.
And then Dane County, what they were doing is they were doing drive-through vaccination sites. Same thing, you waited for 15 minutes or 30 minutes. That is a requirement that you sign when you register for the vaccination.
Okay, thank you.
great. Okay. Well, everybody have good luck and stay healthy till we meet next week. And that will be 27th now, Wednesday. And hopefully there will be ease of vaccine. And I know a couple of people who've been appointed on the COVID task force by Biden. And they are very capable people, and they will do their best to get the vaccine where it's needed the most. And we will be getting to group 1B and 1A and B, now 2A. We'll be getting to teachers and, the transportation and all that. So it will be good.
Doc, since your retirement, this is the third doctor that I am losing. So I think you just need to come out of retirement.
Oh, good. Then what's my bonus for getting the vaccine?
Do I have a second here?
She will get $500, you know that?
This is the third doctor. Oh.
But if we come back, Penny, then he's got to pay me a bonus for getting the vaccine.
And we'll go backdated, Joanne.
Oh, you're backdated. Oh, that's better yet. How many years?
I don't even count. We have the computer guy, Dewey will calculate it.
Oh,
Yeah,
yeah.
He'll let you know how much you owe me.
Well, remember, Joanne, that's what we always did. Sat around when I had to wait for an hour always after my
Exactly. That's why I was
allergy shot.
asking.
We worked on Doc's computer stuff.
Yeah, exactly.
I haven't stopped working on that. I have a
Mm-mm.
small program, religion and culture sensitivity. So you go to Apple store and download CR sensitivity, culture and religion sensitivity. It's a question answer. So you know different religions when you see the patient and how you care for that patient if he's a Muslim, Hindu, Sikh, Christian, or a Jew or atheist. So
Oh, that's cool.
I just put it on yesterday. I spent a lot of time. I did it myself. I'm very proud.
So you wrote the application. Way to go.
I
So we are going to be broadening our horizon, let me tell you.
So see if he comes out of retirement, then he can apply it.
yeah. So that so I had the kids check it. I said, why don't you answer those questions? He said, Dad, you were biased. All the first answer is the correct one. So why don't you mix them up? I said, I'll mix them up.
Your kids will let you know.
Yes. Okay. All right. Okay.
Thank you very
Good
much.
night. Good night.
Thanks,
Thank you
Doc.
so much.
Thank you.
Thank you.
Wonderful.
Bye.
Doc,
Yeah.
good night.
Thanks, Doc.
Yeah. Thank you again.
Bye, Joanne.
Bye, Joey.
Bye, Joanne.
Bye, Cheryl. Bye, Doctor.
Yes.
Bye, Cody.
Yeah. Bye bye.